All right, welcome. Tonight, we are here for the basics on teen substance use. This is about a 90-minute presentation. We will be talking to a couple folks from the community, parents, youth with lived experience, as well as Jonathan Lowe, a member of the Tahoe Forest Health System, to give us some guidance and education. We'll have an opportunity for questions and answers, and then we have a call to action for all of you. I'm Shannon Decker. I will be moderating this evening. On the other end, we have Reina Sanchez Carrera. She's our interpreter. And if you are looking for Spanish language, down in the bottom, you can hit interpretation and then choose Spanish. We're going to start off with Missy Pursel, who is a nurse at Tahoe Forest, as well as a parent in the community, sharing about 5 minutes of her perspective of teen substance use and just the current climate in the Truckee Tahoe area. Then we'll have Brian and Zach sharing a little bit of a youth perspective. We'll switch over to Jonathan Lowe, and then we'll have time for Q&A. Mental Health in the Mountains started with the Truckee Tahoe Suicide Prevention Coalition back in 2016. It is an opportunity for us to come together to have some crucial conversations in our community on things that impact us across the board. Again, you can check out the interpretation and select Spanish if you wish. You can stay involved with us year-round. The Truckee Tahoe Suicide Prevention Coalition is now housed with Sierra Community House. You can follow us on Facebook. Somehow I'm being muted. I apologize for that. We will have a recording of tonight's session available at the tahoelifeline.org/blog. You will receive an email when this is ready for you to view, and it has a bunch of resources available as well. You can also sign up for our newsletter to stay up to date on the happenings that are taking place. And so with that, I'm going to stop sharing, and I'm going to hand it over to Missy Pursel to share.
Hi, so I'm not sure how many people know me in the community or not. I've been a labor and delivery nurse at the hospital for a long time, 25 years, and I've just recently gone into a pediatric care coordinator position. So I'm working a lot with our youth in the community now. My perspective, I have two boys, one's 17 and one's 20, and I have to say that the teenage years were tough. I thought I was doing everything right when I, was coaching them in soccer. We were doing Boy Scouts, got into high school, and everything happened and changed. And it was really stressful. Finding out one of my, my youngest was when I've gotten permission from my boys, just so you know, to talk about them. When I first found the vape pen, I didn't even know what it was. They were telling me it was a candle. I believed them. I didn't imagine that was even a thing. And it turns out it was. What, my younger son says then led into, well, why not just smoke weed? So I sort of went through a range of motions. I had a lot of friends that were my kids. My personal friends were the parents of my kids' friends. So when I found out about all of the things going on, I felt isolated. And I'm giving my perspective just from my perspective. I am married. I'm not giving my husband's perspective because that's his personal experience as well. But my thing is I felt like I was in a silo, sort of not knowing how I could share what was going on with my kids, with my friends, just because I didn't want them to be judged. I didn't want them to judge my kids. I didn't want them to do the things that I had done before. Oh my God, that kid's doing drugs. Don't hang out with him. I don't want my kid hanging out with them. There was a lot of stigma and fear, fear of what my kid's future would hold, of their safety, of their health. Um, and it turns out that a lot of the kids that have died this past year of overdoses were friends of my kids, both of them. And that is where it really shook me right now, that I need to be a motivator to help other parents realize that they're not alone in this, that they feel alone and they feel scared. You may feel scared, but there are people that are going through exactly what you're going through, and we just need to gang together and talk about it and figure out how we can help our kids instead of push them away by our fears and our frustrations. And that's what happens. You find out your child's doing something that you never thought that they would do, and then you freak out, you get angry with them, or you don't have a plan set up, it sort of shocks you, and then you push them away. So I'm hoping that in bringing this into the light, that I hesitate to say everything in a big group just because of all of those reasons, the judging, the stigma, and everything like that. But I just feel like somebody's got to do it, and we need to make it a safe place for parents to be able to talk about things with their kids and with their friends, and not feel like they're bad parents, and that their kids are not bad kids, because they're not bad kids. I know my kids are great kids. They're wonderful kids. They were not big sports kids. They didn't really get into sports, but I do know that there are a lot of kids that are in sports, and they do straight A's, and they do all the stuff that my kids are doing too, but their parents just may not know about it. So that's the scary part too, is, you want to keep an open line of communication that's healthy for both you and your kids. And Jonathan will go all into that because he's wonderful. But just as a parent perspective, love your kid unconditionally and just keep those lines of communication open, because you never know when they're not going to be around. And that's happened to a lot of parents. And the community doesn't even know about it, which makes me really sad for those families that have lost children. And we just need to be out there to support them. So I think I'm good.
Missy, we very much appreciate you sharing that. The loving unconditionally, the talking about the hard stuff is vital. Many communities are in the same place that we are at right now. Life is hard. COVID has made it harder. And we are going to, we're gonna have the tough conversations. So thank you.
Thank you.
For the people who have signed in late, there's a note in the chat box. If you are looking for Spanish interpretation, there is a globe-like symbol that says interpretation. You can check that and then select Spanish. And for everyone who is going to be presenting, we're speaking a little bit slowly so that we have an opportunity to translate. Missy, thank you again. I'm going to hand things over to Brian. Brian is a young adult in our community, and he's going to share his perspective.
Thank you. Well, good evening, everyone. My name is Brian Velasco. I am the new community prevention educator for Sierra Community House. I was born and raised here, actually, in the Truckee and Kings Beach community. And as a 21-year-old, I have definitely noticed a lot of changes with substance abuse in just a few years that I've been out of high school. And for example, that being a prescription or prescribed medications and their counterfeit versions, they're so easily accessible. It's terrifying. And with the current state of the world, I feel like we can all agree that it's been emotionally and mentally exhausting for everyone, including these teens in middle school and high school, especially for older teens who have all these new responsibilities, whether that's at home or school, are about to graduate or are making tough personal decisions. They're just trying to meet certain expectations. I feel like there's a big cry for relief there, and some of these teens that, don't have the coping skills to deal with all this stress at such a young age. And so who do they go? What can they turn to? And that's most likely, to their friends, their neighbors, different families, or even strangers. And I feel like that's where they can easily be exposed to all of this. For example, like so and so's mom, dad, cousin, brother, sister, or friend, has a prescription for this. Here, try it, or has this, and here, try it. It's just like I said, in that moment of desperation and need of that relief, it makes it so easy to just turn to a stranger or just start taking anything as long as it helps. And but now I feel like the best thing that I've seen that helps, and as someone who has suffered from or suffers from anxiety disorder and depression, the greatest thing that has helped me is being the person who listens, being that person who can empathize. And most of the times, these teens, they're not looking for answers. They're just looking for an ear to listen to them. And so most of these teens that, they're struggling with substance abuse, there's this big fear. There's like, I'm gonna get in trouble for doing this or trying that. So I only have 5 minutes, so to wrap this up, I just want to encourage everyone to kind of take a step back and really listen to these teens and help them develop those healthy coping skills. Thank you.
Thank you, Brian. I appreciate your insight. I'm going to hand things over to Zach. Zach is also joining us to share a bit of perspective from a young adult.
Yes, hi, hello everybody. My name is Zach. I'm with Gateway Mountain Center. And yeah, like Brian was saying, just in the past few years, I've noticed a lot of change in our community, and I'm recognizing that, this is not the same Truckee that I grew up in, and it's really scary. I've lost a few friends this year elsewhere to some of these counterfeit pills that are going around, and it's probably more common to find a fake pill nowadays than it is a real pill. And I myself experienced coming up almost a year ago now a near fatal overdose due to these counterfeit pills that are going around. And it really shocked me. It didn't become real for me until I came that close to death. And I kind of not only felt sort of a calling, but almost a responsibility to share my story and to, be that ear to listen to some of these kids. And on Tuesdays, I've been running a work group here at Gateway, and it's really profound hearing, some of these young men and women given the opportunity to share and be vulnerable. Some of them may have never experienced someone, actually listening to them. And so it's amazing seeing that. But I think that these issues, they need to be talked about more. And it's outdated now to, keep sweeping this under the rug, because it's going to keep happening. And getting worse. And I just think it's great that we're talking about this. And yeah, that's kind of my standpoint on things.
Zach, thank you so much for sharing that. And thank you for being empowered to find recovery for yourself and to share that message with others. We have some information, some education that will be provided by Jonathan Lowe, and then we'll have an opportunity for some Q&A. I know that Zach is going to have to drop off early, so if you do have questions for Zach, if you could drop those into the chat box, he could probably facilitate that as we progress on. I just want to give a quick second to make sure that the translation is caught up. So with that, Jonathan, if you would like to grab the share screen, you're welcome to share your deck.
Okay, and so would you like me to share the slides or will you be controlling those?
You know, we could do it either way. Which would you prefer?
I don't want to be in control.
Then I will.
Take over.
One moment. There we go. All right.
Okay, wonderful. Thank you so much for inviting me here tonight. I'm Jonathan Lowe. I'm a psychiatric provider with Tahoe Forest Hospital. I will make a conscious attempt to talk slowly, but anybody who knows me will tell you that that is a big, big ask. So I apologize if I go a little fast here. This is a big topic to cover. I'm only going to be able to really kind of cover that tip of the iceberg, so to speak. I tried to pick substances that I have encountered more frequently since coming here to Truckee. A little bit about my background, right? I moved here last March, just as everything was kind of shutting down. I had been in talks with Tahoe Forest Hospital from a program that I was running in Connecticut called Turnbridge, where I was director. And we treated developmental adolescents with severe mental health issues, including substance use disorder. I had been doing that for years, but I grew up in South Lake Tahoe. I went to school in Littell on the Nevada side. I was very familiar with the area and had some roots here. So when the opportunity came to move all the way across country with my family, we jumped at the opportunity and it also provided me a chance to give back, having grown up in a ski town. These towns are pretty similar. My experience growing up, I believe, was very similar to the experience for anyone growing up in Truckee. And that was, I grew up in a small town, but was exposed to high amounts of substances and heavier substances at a younger age than my counterparts who I would kind of later meet and share stories with at university or after I finished high school. I would talk about my high school experience in the small town and what I saw or did or behaviors I engaged in. And I often found that people were shocked. And I think, again, that can be unique to these communities. So I'm happy to be here to help out in any way that I can. First, want to thank the speakers. Missy, I know you said you thought that you did everything right. You did. Yeah, I can tell you, you did everything right. I think Missy spoke to something that is near and dear to my heart, and that is decreasing the stigma of these illnesses. A few years ago, gave a talk at a very well-known high school in Connecticut, very similar to this because they were struggling with some recent overdose deaths. And we discussed and talked about this idea that substance use disorder, even though we are understanding it more and more as a disease and how the brain looks and changes with exposure to these substances, it's not a casserole disease, right? So if my family member is suffering with substance use disorder, no one's bringing me a casserole, right? I'm not necessarily feeling comfortable with announcing it to the community. There might not be a 5K walk to organize some money to help my loved one get into treatment or get the treatment that they need. It's getting better. We're doing better. And a huge part of that, it's meetings like this. So thank you to everyone who's watching. This is really important. It starts here. Brian, Zach, you guys sound awesome. I hope I run into you in the future. I'm going to blow up your spot here a little bit with talking about developmental adolescence, so I apologize. But good on you, Zach and Brian. Way to go, and recovery's tough, but it's so worth it. Education background for me. So I studied at the University of Pennsylvania After finishing school there, I went to work in the Philadelphia prison system with severe mental illness and drug abuse. There's quite a lot of drug abuse and detox going on in the prison. From there, I moved out into the community and started doing in-home work. And then, of course, larger addiction and mental health treatment centers. And now here in Truckee, the practice focus for me right now, currently in Truckee, is that I am working with adults 18 and up here in town. And we are expanding services all the time here to support our kids too. Recently, we have added a therapist and a behavioral health intensivist to the pediatric side, and we will continue to work on efforts through the hospital to expand services. I know that can be hard in small towns like this. It certainly was the case when I was growing up in South Lake Tahoe. We can talk about the importance of this talk and why it matters, why it's so important that we discuss the teen substance use. We can have a huge effect as a community and as adults with the outcome. And it's all about delaying. We know that it's not about just punitive measures. We know it's not about just saying no, right? I came from the just say no generation, and fat load of good that did me and my friends, and I'll speak to that a little bit later. But we know that delaying and minimizing exposure is incredibly important and can be a game changer for some substances. The average age of first use nationally, right, of alcohol or drugs is going to be 15. When we talk about first exposure in some communities, when we're including products like nicotine, it can go as low as 12 years old. In Connecticut, where I was from, that high school I was speaking at, I was asked because we found out that the average age of first use there was 12 and a half. And I would ask that you think about your own stories, right? Think about your own exposure as we talk about these subjects and relate it to maybe what our teens might be going through today. As I update you on some of the more recent data and substances I think you all should be aware of. So we can move on to the next slide. I think now is good. Okay, so this is the easiest way I can explain the effects and the transition rates to substance use disorders with adolescents. So it's the 2 out of 10 rule. And so when I'm working with a group of kids or with a group of adults, it's the basic rule. If I send 10 kids out into the woods, and it doesn't matter what the substance is, I want everybody to forget about the idea of a gateway drug. There's no such thing. It's just whatever's used first. So I send 10 kids out into the woods to party, right? They pick beer or cannabis or pressed pills, and any of these things, right? On average, across the board, I say that 8 of them are going to walk out of that experience and be okay, and 2 of them are not. 2 of them are going to start a process, right? Kind of light a fire that is going to continue to rage and burn and might cost them their lives. Again, I know that when I was young, that it wasn't explained to me like that. It may not have changed my behaviors or my friends' behaviors in any way, but I certainly didn't take responsibility or look to any problems in my friends who I cared very deeply about, because I didn't think problems were possible at that age. We talked about the long-term effects. People were always telling us, what would happen kind of in adulthood, but that seems so far away. But knowing that 2 out of 10 rule can sometimes be helpful when we think about what is the risk of exposing these youngsters to products like nicotine, alcohol, cannabis, you pick, right? The other things that are important to understand about adolescence, and I think where we should start before we get into specific substances, is language and definitions, right? So tonight I'm really going to be focusing on 12 to 17-year-olds, right? So we typically think 12 to 14 is early adolescence, and up to 15 to 17 as late adolescence. I like to focus also on developmental adolescence, which is a very tricky period in human development from the time that we go through puberty until the time that we are a functioning member of our adult society. And that can, culture can play a big role in that. The reason why it's so tricky is because during this period of development, we are losing ground, right? We're going backwards in our frontal cortex. And this is important because that part of our brain is our decision maker. It starts, that's the part of our brain that helps us to understand consequences. Right? This is the chess player of the brain. And so a lot of us, I have a 13-year-old and a 9-year-old, as our children enter adolescence, we see this shift as if they forgot how to make good choices all of a sudden. And maybe we question, oh goodness, did I lose you?
I think you're good, Jonathan.
Oh, am I? Okay, it's just my screen. I don't need to see the screen. It's just blocked me out. So hold on.
We're all good on our end.
All right, perfect. Just not me. Oh, the joys of Zoom. There we go. So developmental adolescence, we're losing ground in that frontal cortex, and that's our decision maker. Meanwhile, at the same time, we're seeing a hyperactive and amygdala, like the pleasure center, risk-taking center of the brain, as active as it will ever be. So here we are making impulsive decisions based highly on emotion, with a decreased ability to think through problems or think about where, what outcomes lie ahead. And that's what we're up against when we're treating or talking or working with adolescents. And it's important for us to remember that, because as we become adults, we think like adults. We view the world through an adult lens, and it's important to remember who we're talking about and who we're working with when we're talking about potential treatments and potential solves for the problems that we're going to face. The language also becomes important when we talk about the diagnosis, right? With mental health issues, specifically substance use disorders with adolescents, because it's not a well-studied population. The diagnostic manuals that we use in medicine weren't designed to diagnose substance use disorders in kids, right? These were based on studies largely with adults. However, our understanding has broadened, and the language that we are now using, the preferred language, is substance use disorder. So you won't hear addiction as much anymore. And I think that's a good thing, because I think when many of us hear the word addict, we have a very particular picture in our mind. And oftentimes I hear from parents or patients that they don't consider themselves, addicts. And I say, okay, that's fine. And when I ask them what they define an addict as, and they explain to me what that definition is, they're right. They don't meet that definition. But a substance use disorder, many do, and we'll talk about that a little bit further as we move forward. We're going to talk about tolerance, right? So tolerance of a drug, meaning we require higher doses of that substance to produce the desired effect, or we need to use that substance more frequently. Dependence, and that's when we undergo physiological changes and brain changes. So our brain adapts to a point where the new normal function of the brain can't occur without that substance. So a mild example of this is that I am dependent on caffeine, right? So without caffeine, I am not a very functional person. Right, I go through withdrawal symptoms. I can't stand to be in the light. I get severe migraines. I can't function, and that's on the mild end of things. And then on the heavier end of things, of course, there are dependencies to stimulants and opioids and things like this. And then we have addiction, and the difference between the dependence and the addiction, or what we often classify as addiction, really comes down to behaviors, right? So it is possible to be dependent on a substance without being addicted. So think of prescription drugs that somebody might be taking for pain. They are taking them as prescribed. or benzodiazepines. Maybe they're taking them as prescribed, but they build up a dependency to them. So without them, they experience withdrawal effects. Whereas addiction leads to oftentimes antisocial behaviors, and the primary focus is now obtaining that drug despite the negative consequences of the use. So there's clear negative consequences, and the addiction kind of hijacks the system. And that's a problem only in that there are certain lifestyles and communities that don't allow the addiction necessarily to present itself, until it becomes a problem, right? I often say this to my patients, it's not a problem unless it's a problem. I think college can be a good example. There are certain environments where drinking to excess or using drugs is promoted as normal. And oftentimes there are protections in that community or in those environments that don't allow for the negative consequences to take hold for someone to start to think of themselves as an addict, which is again why I like the kind of newer language of substance use disorder. We can move to the next slide. So we'll get into some of the substances now I think we should cover. I think that, I believe, Brian, I think you were speaking to this earlier, but another piece that's important here when we're talking about any of these substances is what some people call co-occurring diagnoses, and that's often used when somebody is having a mental health issue or diagnosis or meets criteria for diagnosis other than the substance use disorder. Personally, I'm not a huge fan of the co-occurring language. I think it minimizes, and for us as parents and patients, it makes us imagine that these things exist in their own little boxes, right? So, here's my depression, or here's my anxiety, and here's the substance use disorder. And it's just not that simple, right? The substance use actually is oftentimes just a symptom of a much larger problem. Between 30 and 45% of adolescents who have a mental health disorder also meet criteria for substance use disorder, and 65% of adolescents with a substance use disorder meet criteria for another mental health disorder. So I think it's really hard to separate these things, but it's important to remember that because we need to screen for these problems constantly, all of the time. And we can talk a little further as we go down about some of the more common mental health symptoms outside of just anxiety or depression that we might be familiar with, that we often see with adolescents and substance use disorders. So when it comes to nicotine, right? This is something I believe that the town is pretty familiar with. When I first moved here, I was quickly educated to some of the problems at the local schools with vaping. Of course, we were seeing these problems back east too, so it wasn't anything new to me, certainly. Current statistics put about 70% of adolescents, right, report having used a nicotine product at least once. And the majority of that, over 40%, remains vaping products. We may be seeing the beginnings of a trend downward, but it's going to be really hard to say. The pandemic, of course, has changed everything about how people are using and what, and we may not know the full effects of the pandemic for quite some time. We do know that exposing our youngsters, the adolescent brain to nicotine has a very different effect than when we expose a more maturated or a more mature brain to nicotine. The prefrontal cortex that I was talking about that is going through all of this development during adolescence is highly susceptible to nicotine exposure. It's not just nicotininergic receptors. We know that there's some pretty heavy involvement with the prefrontal cortex. And so this can lead to lifelong effects and lifelong problems in the development of that prefrontal cortex with frequent exposure to nicotine. So these the perceived positive effects are also greater, right? So when adolescents use nicotine, the pleasure is greater. But in many studies, the negative effects of withdrawal aren't as severe as they are with adults. And so sometimes when we are trying to help, depending on the case, an adolescent quit vaping or smoking, the best method may be an abstinence-based method with behavioral interventions as the primary, rather than looking through the lens of, say, nicotine replacement therapy, which is mostly based on, it's heavily based on adults and traditional tobacco products. And vaping, there's still a lot we don't know about how to help people quit vaping, especially adolescents. But what we do know is that they seem to suffer the negative consequences of withdrawal less than their adult counterparts. When we ingest nicotine as a developmental adolescent, it changes the gene expression in that frontal cortex. And this can lead to long-lasting problems with impulse control, can lead to a higher prevalence or future diagnosis of psychiatric illnesses like ADHD, right? Attention deficit disorders. This also changes the way that the brain perceives the rewards from other substances. So again, there's no such thing as a quote unquote gateway drug. It's just whatever we have access to first. But nicotine primes the brain, certainly, to respond in a more sensitive way, in a more profound way, to substance exposure in the future to different drugs, including alcohol, by the way. So including alcohol in terms of the way that it might increase the sensitivity or the pleasurable effects that we might experience as an adolescent when we ingest alcohol. We can actually move on to the next slide, alcohol. We'll keep it going.
Right. I'm listening to the translation. We're going to take just a quick second.
Oh, no problem.
Okay, here we go.
So, alcohol, and in adolescence especially, these used to be our diagnostic orphans. So going back earlier to that difficulty with language, the diagnostic manuals that we were using to diagnose folks with substance use disorders was leaving out a huge segment of the population, especially with adolescent use, that may not present with the same signs and symptoms. We know that the most recent research shows that 25% of 8th graders, right, have used alcohol within the last year, and that increases up to 46% by the 10th grade, and then over 60% by senior year. Again, this can change from town to town depending on exposure, but that is overall what we're seeing nationally. The rates of alcohol use disorder are or tend to be a bit higher than the national average in towns like Truckee or in ski towns. A lot of that just has to do with culture and access. Many of these towns are built to serve, the ski industry and really just incoming tourists to, have fun during the day, recreating outside. And then oftentimes, once the sun goes down, the bars open up, and that's kind of what people do in that, right? There may not be much else to do outside of that. I know certainly that was my perception growing up, right? I grew up, again, in South Lake Tahoe. I didn't grow up a skier or anything like that. My parents didn't have, the money. We couldn't afford to do those types of sports. Spent plenty of time wandering around the woods, of course. But when the sun went down, there weren't a whole lot of options for us. We didn't have a teen center or a place to kind of congregate other than the casinos. And so again, you kind of grow up around this culture of partying constantly, and that's just what people do. And we know that that has an effect on the perceptions of kids and adolescents in terms of use, right? And how safe it is to explore using drugs and alcohol. We can move on to the next slide. Cannabis, right? This is another big one. Certainly bigger here than it was for me in Connecticut. Not that it didn't exist in Connecticut, it certainly did, but we didn't have or at least for the majority of time that I was there, it wasn't legalized for recreational use. Here, I see a lot, more of it, and I see a lot more of the normalization of use. And I think that sometimes we can forget about the known, and it's well known, some of the harms that cannabis can present. So when we talk about statistics this past year for 2020, about 11% of 8th graders and 35% of seniors have used cannabis products. Again, we need to take into account that that's national. So that represents states that still haven't legalized this product. And I wouldn't be surprised to hear that our rates might be a little bit higher than national averages. Around 10%, and this has remained consistent, around 10% of individuals who smoke cannabis will meet criteria for cannabis dependency, meaning that they do suffer in mild, moderate, rarely do I see severe effects without cannabis use. That 10% overall increases up to 17% if we expose an adolescent to cannabis. So again, the importance of delaying, right? If I can save 7% of the population from having a dependency issue to cannabis just by delaying their exposure to that drug, that's awesome to know that we can do that just with time and some patience, right? There are other higher risks when used frequently in adolescents, especially with earlier exposures, ages 14, right? We have seen studies that it can lower IQ, which is really interesting when it comes to cannabis and very unique to that product. And the IQ in some studies has shown not to rebound, meaning that there is no improvement after somebody achieves recovery or sobriety from cannabis. So that is a long-lasting effect. The other bigger issue that I was seeing out in Connecticut was cannabis-induced psychosis. With higher THC products, we know that some individuals who won't know, again, until they know, who ingest cannabis products are more prone to psychotic episodes. There has been a large study, over 2,000 patients, right, that has shown that following cannabis-induced psychosis, almost 50, so almost half of people who experience cannabis-induced psychosis will convert either to bipolar 1 or schizophrenic type diagnosis. So meaning that the effects last so long that they meet criteria for these new disorders, and we're talking now about a serious mental illness that will probably require lifelong treatment. And that's huge, right? And so we were seeing a lot of these kids at the Yale emergency room. They're tough. It's tough to treat, and you don't really know what you're treating until you can at least ensure that substances have been removed from the picture for a period of time. So if, to think, I guess the point is to think that cannabis is a harmless drug or to normalize it, there's a lot of danger and risk there. We can move on to the next slide.
Okay. One moment. I don't know if it changed for you. Something happened on my end. Give me just one moment.
No problem.
I'll take a quick pause. I don't know what happened. It just...
Well, again, the slides are really just meant to be there as placeholders. I can just continue to go on.
Okay, go for it.
That's okay. So the next I want to go over is benzodiazepines, right? Benzodiazepines, so some of us might be familiar with things like Valium or diazepam, clonazepam, alprazolam. They all sound like Harry Potter spells to me. I always thought. The benzodiazepines are widespread CNS depressants. So the best way I can explain a benzodiazepine is think of benzodiazepines like astronaut alcohol, right? Alcohol in a pill form. So I could potentially hook myself up to a functional MRI to show me how my brain is working on the screen and hook someone else up next to me. And one of us has, maybe a bar of Xanax and the other person takes a few shots of hard liquor, and we wouldn't necessarily be able to tell whose brain was who ingested which substance based on the brain response alone. Benzodiazepines were really marketed in a very clever way, especially Xanax or alprazolam, kind of touted as a wonder drug that could be taken for all sorts of reasons. Feeling nervous, have some Xanax. Feeling down, have some Xanax. Bored at home, have some Xanax. And targeted really at the time, the market was really housewives, right? The effect of benzodiazepines, of course, is that we can build up a tolerance and a dependency quite quickly. Benzodiazepines are not the preferred treatment for anxiety disorders that are chronic. They are used to treat panic disorders, which panic attacks are meant, or at least should be happening, kind of infrequently and not on a regular basis. So the rule of thumb is if I have a patient who I'm starting on a benzodiazepine, they really shouldn't use it more than 10 days in a row to prevent dependency, because there will be physical withdrawal symptoms, and again, tolerance can build up. One of the issues with the benzos, and I believe it was either Zach or Brian who touched on it earlier, maybe Brian, the pressed pill market. So for those of you who may not be aware, we do have a pretty robust pressed pill market here in Truckee and in plenty of other places in the country. And these sometimes the counterfeit pills it's very hard to tell the difference. And then sometimes they're also just ordered, right? Pharmapram, which is a benzodiazepine produced in Mexico, can sometimes be brought over or shipped by savvy internet users. It is more common that I'm hearing about these pressed pills that are being sold as a benzodiazepine like Xanax containing small amounts of fentanyl as well, which is really dangerous because someone might think they know what they're ingesting, and they come to find out that they've taken fentanyl, which we'll talk about here in a minute, and this can put them into a life-threatening situation because now they've taken 2 respiratory depressants. So both the benzodiazepines and the fentanyl, opiate or opioids, can depress breathing.
Jonathan?
Yes.
Interrupt for just a moment. Could you define what a pressed pill is?
Yes. So if I was in the pressed pill market, right, I would be taking synthetic drugs or chemicals, right? Pressing them into a pill that looks, again, some of these pills, you wouldn't be able to tell the difference between what I prescribe, like the Xanax that I prescribe, and somebody who's making the Xanax on the street, meaning that they are producing these, in a lab or in their home, right? And then selling them as the prescription medication. This also happens with stimulants that we'll talk about in a little bit, and opioids, by the way. It really comes down to markets and access. So we enacted the prescription monitoring program in this country, too late, but we still did it, and it's good and it's important. One of the side effects of the prescription monitoring program, meaning that when I prescribe a controlled substance, like a benzodiazepine, I have to check the prescription monitoring program, and it tells me if the patient has filled a controlled substance, when they filled it, what it was, who it was prescribed by, right? And one of the intended effects of that was to decrease overprescription or doctor shopping, right? But by reducing the product, reducing the availability, it's not as if folks who were making a living off of selling drugs said, oh, well, the prescription monitoring program is up and running. I guess I should go, find a new job or get that degree I always wanted. They just shift. And a big part of that shift is into, again, the pressed pill market. So it's something for everybody to be aware of. And it's hard to know. There are companies out there that will, if you find something that looks suspicious, but you check it on the internet and it looks almost identical to what you're seeing on the internet. Maybe it looks like an Adderall, or maybe it looks like a Xanax. There are companies out there that can test these drugs to find out what's actually in them. So you're aware, and if anybody's interested in that, they can always reach out to me and I can point you towards some good people. But that is what a pressed pill is. Okay. And we can move on to the next one.
A pressed pill could be from a pharmacy where you actually have a prescription, but it could also be a counterfeit pill that was made by somebody's homemade press.
Yeah, correct. The press pill market is what we refer to as, again, that black market of pill making, right? So a pressed pill, you can, again, when we say pressed pills, we're referring to in the addiction community or substance use treatment community, that black market, right? But again, you can abuse a pressed benzodiazepine, one that someone made them, or a prescription made by a drug company, right? Both are highly addictive. With the pressed pill market, we often see additives like fentanyl for cost saving purposes, because there's a lot of money to be made off of fentanyl. It doesn't take a lot of fentanyl to produce a very high, strong high effect. And that's, we're starting to see that more and more show up in other products, and people just aren't aware of what they're ingesting. They think that they know what they're taking. So the recommendation, of course, is always, don't take, a stimulant medication that you think is Adderall if it wasn't prescribed to you. Don't take what you think was Xanax if it wasn't prescribed to you. I had a patient recently who this happened to on New Year's. He took what he thought was a Xanax from someone he knew, and luckily he's okay, but he found out that it had fentanyl in it and had a really, really awful experience, and is lucky to be alive. But he definitely wasn't intending on using an opiate or an opioid, right? So let's talk about those next. And I think that this, again, a lot of these we're probably familiar with because of recent, news and becoming a little bit more conscious and aware of what's happening. Opioid overdose is on the rise. We've seen this during the pandemic, probably in large part due to treatment communities being torn apart by the pandemic. So folks who heavily rely on social connection in order to stay well had that rug pulled out from under them, so to speak. Personal experience. My brother died of an opioid overdose over the pandemic just a few months back. So I know firsthand what this is doing out there. We may be familiar with things like Percocets, right? We may be familiar with prescription drugs that we might have taken for pain, right? We may even be familiar with fentanyl. We may be less familiar with things like carfentanil, right? Even more potent forms of synthetic opioids. I think that the important thing to know is that 80% of heroin users, right? So the majority of people who end up using heroin were first started with a prescription opioid. They didn't start, and most of that, by the way, it was either through a legitimate prescription that they received or in the home environment. And again, we'll talk about the home environment in a little bit here when we discuss like what can we do as a community. And going back to my own personal experience, that's certainly what was it for my brother when he was in high school and on the football team. There was the wife of a dentist who would give the high schoolers a prescription pain medicine after games to kind of help, ease the pain. Good job, guys. You deserve this. And at the time, I don't think, honestly, that anyone really knew. I mean, hearing that now just, shocks me. But at the time, we also weren't having discussions about pain medication like we are today. So this was back in the late 90s, mid to late 90s. And going back that 2 out of 10 rule, my brother was just one of the unlucky ones, right? It just woke something up in him. And really what it did for him is it made him feel not anxious for the first time. It felt great not to feel that pit of anxiety in his stomach. It just went away. He didn't have to go to hours of therapy. He didn't have to work at it. All he had to do was swallow the substance, and how profound. I now feel like I'm a part of the world. And when it comes to opiate use disorders, especially, it's often one that I say, as with many drugs, right? These drugs have both saved the lives of many of my patients and are destroying them, right? So it's not black and white, but it's important to know where it starts. And it really does start with the prescription opioid medication. I understand, and I'd heard that there's going to be, a discussion at the end of this about Narcan and overdose prevention, which is a huge passion of mine as well. So we'll talk a little bit further, I'm sure, about opioids along the way. If you have any questions, bring them up in the question and answer section. I'm happy to talk all day. I could do a whole talk, a whole month on opioids alone. But I do want to cover a couple of other substances before we start the Q&A. Stimulants, right? So examples of common amphetamines would be like Adderall or Vyvanse, crystal methamphetamine. Prescription stimulants, when taken for the treatment of ADHD in children, have actually been shown to decrease decrease the rates of conversion into a substance use disorder. And for a long time, that wasn't the thought. The thought was, well, if we expose these kids to stimulants at a young age, they're going to be at higher risk. And now what we know through multiple studies is that it can be the exact opposite. So if we have a child who does have ADHD, and they are not effectively treated, and by the way, it does not have to be stimulant medication. There are lots of ways to treat ADHD in children. But if they're not treated and not helped, then they fall behind in school, right? That doesn't feel good. They might find other ways, again, to find success in life. And that might be using substances. They might find something that they're good at, right? They might find a way just to not feel like they're failing at their job, which is to be a student. So I think that that's important to note. However, they are still heavily abusable. Illicit stimulants like cocaine, right? It doesn't really matter when we start using those stimulants. We don't necessarily see a difference between exposure at a younger age or an older age in terms of substance use disorders or getting dependent on stimulants. They are just high rates of conversion into substance use disorders with these drugs, especially methamphetamine and cocaine. I do know that I have seen a recent uptick in our community here in Truckee of cocaine use among adults. And I'm hearing more and more about kids, which only makes sense because when the adults are using, it does trickle down. It's not as if the kids don't get their hands on it. Which is concerning for so many reasons. One of the reasons, again, is that the cocaine that people think that they're using is more often cut or has fentanyl in it, which there's a myth on the street sometimes that using an opioid or an opiate along with a stimulant will somehow protect you from overdose, and that's just not true. It's quite the opposite. So that's something that's happening in our local community. I had talked recently with local law enforcement, and yeah, about 10 years ago, it was kind of on the rise, and just like anything else, it comes and goes in fads. And recently, it does seem to be on the rise in our community. That's something to be aware of. Slide number, yeah, and we can go to the next one. Synthetic cannabinoids. Do not call this stuff fake weed, please. It is not. It could not be further from the truth. Synthetic cannabinoids, you might know or have heard of, probably the most famous is K2, right? Can be called Spice, Joker, Kush, Chronic, both with Ks, right? It can look like a shredded plant. It's sold as potpourri, right? These synthetic drugs oftentimes on the label says not for human consumption, even though that's clearly what it's being sold for. Many of them are still legal. What ends up happening is that if a synthetic substance is made illegal, if I'm producing a synthetic drug, I only need to change a carbon chain, like I need to change a very minuscule amount of it. And then suddenly it's a substance that never existed in human history before. So it can't be illegal until we catch up. And it's always a game of catch up with these things. One of the issues with this drug is just how damaging it is to our brain at any point, but especially the developing brain. You'll often see agitation, hallucinations, increasing things like paranoia and heart rate. Most of those symptoms clear in about 5 to 8 days after exposure to something like a synthetic cannabinoid, but about one third of those patients will transition into a diagnosis of schizophrenia. Another difficult thing about the synthetic market of drugs, which we won't be able to go over all of them, I'm just touching on synthetic cannabinoids because it's pretty easy to get, is that there's no FDA approved treatments, right? We don't really know how to treat it. There is some evidence that cannabinol or CBN, what's called CBN, may be helpful to reduce some of the neurotoxic effects of this drug, but it's unclear. So again, a lot of these drugs are best treated by behavioral interventions, not outside of what medicine can provide. Now, the next slide. So I did a little walk around our town on my lunch break, and I didn't see any synthetic cannabinoids for sale. I did see kratom for sale. So kratom is a tropical tree in Southeast Asia. It was actually outlawed even in some countries because it was starting to carve into the profits being made in the opium trade. So you can buy kratom here at the head shops in town. It's perfectly legal. The only place it's illegal in the state of California is in the city, not the county, but the city of San Diego. It's going to look like a powder, right? And often is consumed as a powder capsule. It can be smoked as well. Some people will chew the kratom leaves, which is the part of the plant that produces the psychedelic-like effect, or psychoactive, like effect, or make tea with it as well. It's in small doses. Here's what's difficult about kratom. In small doses, it mimics a stimulant and stimulant-like high for people. And in larger doses, it mimics an opiate. It mimics opioids, right? Very similar, in fact. They're kind of the bro science, right? The street science of it is that a lot of people will use it to help them naturally come off of other substances. The problem is that it is itself highly addictive. In fact, that's how I learned about my brother's substance use disorder, is that he didn't have time to detox, and he was coming to stay with us at my home in Connecticut. And so he brought a lot of kratom with him. And I saw brown powder, or my wife actually found it on the sink. And as soon as she saw it, she knew, what was up. So this brown dust on the sink, and we knew that it was kratom, and we knew why one would be using kratom. And we're thankful that we were able to hold an intervention and get him some help. But he was certainly addicted to kratom. I treat adults in town that are addicted to kratom. It's difficult to treat. And again, no FDA approved treatment for kratom that exists. So we often treat it because it is so similar to opioids the same way. So some patients will benefit from medication-assisted treatment with medications like naltrexone or Suboxone, right? But it's really dependent on the patient. The withdrawal effects from kratom can be pretty long-lasting and severe in terms of the anxiety that it produces when we no longer have that substance. We can go to the next slide. Let me just fix something on my end. Now we can kind of get into the meat of what do we do. So it's always tough because when I give these talks, my intention, believe me, is not to be an alarmist or scare people. I want to give kind of straightforward information in a way that hopefully is digestible, not in the same way that I might present it to medical professionals, right? But now comes but it is important to talk about these things, right? Again, my intention is not to scare anyone out there. So let's talk about what we can start to do, or how we can be proactive. First of all, it's just recognizing signs and symptoms that our developing adolescent may have an issue with substance use disorder. And I can't tell you how many cases I've treated working with families where, you know, having worked with the adolescent long enough to understand the story in the background, you know, I will, you know, tell the parents about when it started, and they're always shocked. They're, you know, I had no idea. And there's a reason they had no idea, because, you know, the use wasn't meant to be known. Someone was going to great lengths to try and hide that behavior from their parents, and there's no way to know as a parent. You just can't. But when we do look at the timeline, often what we see is at that same time, maybe the parents didn't know that their loved one was using a substance, or the caregiver didn't know that a loved one was using a substance, but we see behavioral changes that start, right? So yes, we might not know that our sons or daughters or loved ones, or the ones we're caring for, are engaging in nicotine abuse or alcohol abuse, or again, any of the substances. But what we may look back and see is there was a decline in grades, right? Radical changes in friendships, more comments coming home from teachers, loss of interest in hobbies or extracurricular activities that they once were engaged with, irritability, they're more argumentative, right? Agitation, restlessness, you know, meaning restlessness, hyperactivity, lethargy, lack of motivation. The problem with a lot of these behaviors, of course, is that we can sometimes normalize them as just adolescence, right? Such a hormonal process. But really looking for those behaviors, especially when it comes to school performance and extracurricular activities and involvement in things that your adolescent at home enjoys. Let the behaviors lead the way. They will always tell the truth. Even when our loved one is not able to, or their substance use disorder is trying to protect itself by lying to us, the behaviors will guide us, right? They're pretty concrete. And so if you're, you know, seeing concerning behaviors, one of the best things to do is to reach out to a professional, if possible, for help or guidance. And a quick example of this is that I was leading a talk similar to this, and a parent came up to me after the talk and said, well, I took this picture of my son's sock drawer. I was putting away his socks, and I found these flower seeds, and there were these little black flower seeds in his sock drawer, you know, like shoved way down under. Do you think I need to be concerned? And I asked her, well, you know, does your son actively garden? Like, is he really into growing flowers? And she said, no. And I said, yes, be concerned. And what they were morning glory seeds, often used as, again, a home remedy to help one not suffer the withdrawal effects from opioids as severely as they otherwise might. So again, look to the behaviors. Your kids aren't just going to necessarily come right out and tell you and be honest. That is really anxiety provoking for anybody, but especially a teenager. So watch those behaviors. Next slide. All right, so what can we do, right? Here's the good news, is that there's things that we can do to help, right? There's things that we can do to delay. Again, messaging is important. I think that it really is about empowering as best as we can our adolescents with good information, good understanding the risks for themselves and their friends. Sometimes even that's more important. They can be more protective of their friends' health than they will be of their own at that age. That it's really about delaying, right? Trying to delay exposure to many of these substances. If we can delay it, even if we can wait until college, it would be ideal to wait a little bit longer. But even if we can wait until college, we can drastically reduce the chance that someone is going to translate into a substance use disorder or diagnosed with serious substance use disorder. Set the tone, right? Think about your environment. A huge factor in the rates of substance use amongst adolescents is their environment. Again, going back to the town of Truckee, when we think about the town of Truckee, what do our teens do after 6 p.m.? And I honestly don't know. I'm too new to town, and it's a pandemic, so my teenager hasn't even explored, meeting anyone yet, let alone what there is to do in the evening time. What does your home look like, right? Are you using alcohol on a regular basis in front of your teenagers? what does that use look like? Are you coming home and kind of moaning about how hard your day was, and then the answer that your kids see is that you go for a beer to that, like that's how you relax, right? Oftentimes that's the messaging we unknowingly send kids, that alcohol is either used to treat a bad experience or to celebrate a good experience. Think about the substances that are in your home, the prescription benzodiazepines, that old prescription for pain medicine that you had when you had a root canal 5 years ago that you probably don't even know is there in the back of a drawer. When we talk about the developmental adolescent, it's important for us to understand that their brain is undergoing more neuronal growth and development than they were when they were infants and toddlers. Now, when our kids are infants and toddlers, as parents, we do a pretty good job, right? We move all the dangerous things from under the sink up high, and we put locks on everything so they can't get into things that might hurt them. And in a way, we kind of need to take the same approach, maybe even more so when they're adolescents. So treat those prescription medicines like bullets, right? And a gun, lock them up for sure, right? Keep an eye on those things. Think about other, it's not just, prescription medications, but other substances in the home too. Again, knowing that impulsive brain of the developmental adolescent, they're more drawn to use inhalants, right? So air duster that you might have in your computer desk to blow the dust out of your keyboard is highly abusable, right? And I've treated plenty of adolescents that was their primary drug of choice was air duster. Your large Costco size of whipped cream in the kitchen, again, not meant to scare you. I don't want you going and throwing away your whipped cream, but just these are things to think about when we think about the environment, just like we thought about our environment when our kids were very small. Gather, the facts. If you find out that your teen is using a substance, take a breath, triage the situation, take a moment, because it's going to, anger might be the natural response, and really born out of fear for the safety of our kids. But then it's really important to gather those facts. Why is your teen using? Are they using it to relax, alleviate boredom, fit in socially, escape emotional or physical pain? Again, we talked about the rates of mental illness like anxiety or depressive disorders occurring along with substance use. Oftentimes, they're not just using just because, right? They're using because it is an effective treatment for whatever it is that they're experiencing. And we want to know that and try to empathize with that. Are they trying to lose weight, right? That's another problem that I see often in towns like this. And certainly, I think it's a larger issue than we talk about in a town like Truckee, and that is disordered eating and eating disorders and orthorexia in both young men and young women in this town, often co-occurring with substance use disorders, by the way. So really think about leading by example. Think about your own relationship with alcohol or drugs. I would be cautious against kind of, constantly telling your kids about, the fun you had in high school. My dad was an old hippie who lived in Haight-Ashbury, and I remember, he's no longer alive, but he would just tell me stories all the time, but it wasn't ever a cautionary tale. It was always a tale of, the fun that he had. And I'm sure that must have had an effect on some of the poor decisions I made growing up. So be careful how we talk about these things. Best thing to do is just let your kid lead the way. You don't necessarily need to have the answers, right? Just listen, just ask them, what do they think? What are their friends up to? Again, if they are using, why? Like, help me understand it. And if they don't feel comfortable talking to you, we certainly have community members, including professionals like myself, that are available to help that process along. Try to remain as positive as possible, right? Relapse in substance use disorders, if our kids are struggling, whether it's nicotine dependence or opioids, right? Relapse is a defining characteristic in chronic illness. So it is not the exception, it is the rule. And relapse in chronic illness, I work really hard with patients to help them understand that it's not a failure, but it is a learning opportunity. So I don't expect patients to get it right the first time. It is not a linear process, but certainly we can learn from relapses and what we might be able to do better. Contingency management can be helpful with teens, more so than punitive measures. These are kind of give to get programs, meaning that if you can commit and we can figure out a way to, as best as we can, make sure that you're not ingesting these substances that I'm concerned about, then here's the reward, here's the get. And the nice thing about Truckee is I think we have a real opportunity there as a town, because we have some pretty cool people living in this town, right? And cool things to do. And then it's just helping kids that might not otherwise have access, getting them access to this to help, release that dopamine in a different way. Testing, right? So I often get asked about urine tox testing. And generally speaking, it's not the most helpful measure, but it can be a helpful measure for some substances in some cases. For instance, if we're concerned about our kid who's trying to quit vaping or nicotine products, there's a pretty cheap test that can be done via urine, saliva, or blood for a metabolite of nicotine called cotinine that can be in our system even days after exposure to nicotine products. The problem with cotinine testing is that, of course, we can't use it if someone's using nicotine replacement therapy. We would expect to see that as a metabolite because they're receiving nicotine. But if we're working with someone who is trying to be abstinent, that can be a way, something you can talk with your healthcare provider about monitoring that. There are plenty of products that we can also order in the home. When it comes to alcohol use disorder, one of the more difficult ones to track because of the limited amount of time that we have to kind of catch it. That might be, a remote breath alcohol monitoring, which can, again, you can buy products at home. There's some that hook up to smartphones for your kids to check in. So there's some pretty clever ways of doing things. But all in all, drug monitoring or tox screening itself is not necessarily going to tell us a whole lot about that patient or their needs. So get them some help, right? Get them with a counselor, get them with a professional if possible. There's also adolescent community reinforcement approach that is very helpful with this population. And this is similar to that contingency kind of plan that I was talking about, but again, it's much more kind of community effort. I know that we have programs in town to help athletes, right? But we have to remember that not everybody's an athlete, right? So, can we or do we have programs, for kids who are interested in theater or music or dance or all sorts of other ways that we can express ourselves that isn't necessarily an extreme sport that not all of our kids might be into? Are there other things that we could be doing as a community to foster an environment where we're replacing? And that's what it's about. It's replacing. We're saying, hey, instead of doing this, how about this? Right? And that's where I see a real opportunity for us in the town of Truckee. There's so much. Again, I could go on and on and on about this, but I want to give some time to talk. I know I've gone over a little bit more than I wanted to, but we're happy to take questions.
All right, so Jonathan, we are going to, let's see. We're going to switch back over here, and I'm going to just change up the order a little bit. Before we do Q&A, because I know that we've got about 6 minutes before our time is up. Jonathan, do you have a little bit longer that you can stay with us this evening?
I absolutely can be here as long as anyone needs me to be.
Okay. Then as I change this up just a little bit, I'm going to run through our resources, our call to action, and our evaluation. This gives you a chance to put your questions into the chat box. I'm going to ask that we use the chat box for the questions because we do have the interpretation piece and they're not able to speak into the English session. So I think that'll be the best way to run that. If you would like to ask the question as opposed to type it, you can raise your hand. There's an emoji. And if you want to ask the question anonymously, you can change your name. So if you hover over your video screen on Zoom, there are 3 dots that come up in the corner. If you go over those dots, you can rename yourself, and you could write in whatever name you would like, or just write anonymous. And so tonight, this conversation, this crucial community conversation, was brought to you by the Tahoe Truckee Unified School District. And on this call is Kim Bradley, representing the school district. If you have questions specifically to Kim, you can put those into the chat and we can ask her. Tahoe Forest Health System is also a sponsor, so thank you, Jonathan. The Truckee Tahoe Suicide Prevention Coalition, I am the coordinator. We've got some other members that are on here as well, but if you can talk about suicide, you can talk about anything. If you know how to ask a question about suicidality, you could ask about drug use. And so a lot of the resources that we have for suicide prevention go hand in hand with substance use. And then we also have River Coyote with us this evening from the Tahoe Truckee Future Without Drug Dependence. I think she can also speak to the athlete program that Jonathan spoke to. So if you have questions for any of these programs, feel free to list that in the chat box and we can have them speak to it. Like I said, there's a lot of ways to stay involved with the Suicide Prevention Coalition. And the recording of tonight in both English and Spanish will be available here on our website blog. It will have a recording, the resources, and our call to action. So some of the resources that I want to talk about are the Center on Addiction and the Partnership for Drug-Free Kids. It has great parent resources. You can text Connect to 55753. You can schedule a call with them. You can email a specialist. In the Truckee Tahoe area locally, we also have the Granite Wellness Center, the Gateway Mountain Center. Both are linked here and have resources. We also have medication-assisted treatment. There is a flyer here that is located at Tahoe Forest Healthcare System. So this would be for opioid addiction. There's information in both English and Spanish. The phone number to get connected with that MAT clinic is 530-582-1212. You can contact Lisa with Youth Behavioral Health Navigation if you're in need of learning how to navigate the health system. There's also some parent-specific resources. Parenting is hard. I think a lot of us are here tonight to examine where we're at with parenting with our own knowledge. And so there is a organization, Parent Guidance, where you can learn a little bit more about education and therapeutic support. We also encourage you to attend Youth Mental Health First Aid. Youth Mental Health First Aid has been offered by the Coalition. It's also offered on an ongoing basis with What's Up Wellness, who I also see is on the call this evening. But there's mental health first aid trainings all across the country. And kind of like what Jonathan was saying, parents are prepared for those younger years. We lock things up, we childproof our house, we go to mommy and me yoga classes. But once we start doing Boy Scouts, Girl Scouts, youth sports, and we're busy with work, where do we continue to build our education about our children and their development? Unless you've studied adolescent development in some type of an academic setting, you might not have been exposed to what it might look like when a young person is struggling and what they might be trying to hide, or some of the things that they're putting out there in nonverbal ways. So we encourage you to take Youth Mental Health First Aid if you haven't already. They just released some new manuals that are really robust in helping with everything under the sun. There is a great college guidance handbook called Starting the Conversation. It's not necessarily geared towards college students, but it's for that age of people who are leaving home for the first time. If they start to struggle, if their friends start to struggle, what are the conversations that you need to have with your child as they turn 18? There's also a handbook here called Talking with College Students About Alcohol. But again, it's that age 16 to 20. How do we have these conversations? And the key takeaway from it is really just communication, modeling, monitoring, parental rules, and the environment. All things that Jonathan touched on. We just unfortunately are not able to be in the same room to have one-off conversations, but through these you might be able to have more conversations or perhaps share them with people in your network to start talking about a little bit further. Earlier this summer, the Forward Coalition and the Suicide Prevention Coalition came together and offered a training, Opioids and Overdose Reversals. We talked about heroin, fentanyl, carafentanil. There's a demonstration on how to use Narcan. And we really encourage folks to understand the basics of opioids and how to administer Narcan. If you're interested, you can watch that recording. It's linked right there. And then you can request a free Narcan kit, and we can get that to you. There is also a safe disposure of unwanted prescription drugs at Truckee Tahoe. So if you need to dispose of any unwanted prescription drugs, that goes constantly out by the airport at Truckee Town Hall. So there's information there. Our call to action is to empower yourself. Take the opioid training, share this information with a friend, maybe take some training on the parent guidance or join a youth mental health first aid when it's available. I know that there's some questions that are coming in. And so while we're doing that, I am just going to, oh, thank you for your patience as we navigate technology. In the chat box, I've put a link to the evaluation form. We would love your feedback. And so with that, I'm going to switch back over to some Q&A. I think most of the questions are coming in for Jonathan, but if there are specific questions for our other folks on the line, or Missy, who shared her perspective as a parent, please feel free. So the first question is, what about secondhand smoke? I had a parent that smoked like a chimney when I was growing up.
Yeah, I flew planes where there was ashtrays and adults smoking right next to me growing up. We know that the secondhand smoke can have those same undesired effects. So increase in impulsivity, types of disorders in developmental brains, right? Exposed frequently to nicotine, higher rates of ADHD. I also think it's interesting that in towns like Truckee, we see higher rates of ADHD, more frequently, right? In towns like this. And that also speaks, I think, in some ways to some of the impulsive use that we encounter up here more often than we might in other parts of the country.
Thank you.
It's pretty common in ski towns.
When is it recommended that kids are drug tested by their parents, and how do you go about if you do see the signs?
First of all, first try and make me the bad guy first, right? Use your healthcare providers. We're great at taking bullets. I've taken more bullets for parents than I can count. So if you can, rather than go straight to drug testing, right? A couple things. One is that we want to start these conversations middle school minimum, right? I actually do really light kind of versions of this, much lighter with elementary school students, where they kind of lead the way in these discussions. But in middle school, we want to start talking about our family's values. We also want to start talking about consequences, right? Because what we don't want to do is chase after this in a panicked moment. So, I want to talk with my teen or adolescent and recognizing that they own nothing, which is we can use to our advantage, right? As adult members of our community, these adolescents, they are not fully functioning adult members of society, and we can absolutely use that to our advantage. My son doesn't have a phone. I pay for that thing. It's mine. I let him borrow it, right? And so if I talk to him about, hey, okay, we're kind of maybe lengthening the tether here. I'm trusting you with this, but I'm also letting you know that if this or this or this happens, what that boundary looks like and what the consequences should you cross that boundary. So when it comes to drug testing, let someone know that if I am ever able to see this, it's going to concern me. And if you don't want to talk to me, that's okay, but I am going to take you to someone to talk to. And maybe it's their pediatrician here at Tahoe Forest Hospital. Maybe it's the counselor in the pediatric department, the behavioral health intensivist. Maybe it's another local counselor. Maybe it's someone at Gateway, right? It could be so many different things, but definitely get them to someone. And we're used to it as professionals, right? We're used to kind of setting those parameters to take parents off of that, because it's an inappropriate role for a parent to suddenly become the treater, right? We don't want parents to have to play that role.
So the next question is about testing kits again. If a parent does need to utilize a testing kit, which do you recommend to identify nicotine and their metabolites?
So nicotine, I would really recommend if they can just get your local healthcare, like whoever your child's healthcare provider is, cotinine testing. It's very inexpensive. It can be done again through urine, saliva with some tests, and probably one of the more accurate ways. Now, if it were traditional cigarettes and not vape, there are devices that can detect carbon monoxide as it's breathed out. But again, you could also just smell your kid's breath if they're smoking traditional cigarettes and probably figure that one out, right? And it won't pick up on vaping. So cotinine testing for nicotine products, whether it's chewing tobacco, the Zins that are really popular right now, or any other form. Cotinine testing, call me if you need me. I can always guide your healthcare provider through the process. It's pretty easy.
Thank you. Can you speak a little bit to mushrooms, as they are very big in the community right now?
Are very big in our community right now. So again, and this is like anything else. It comes in waves. It comes in fads. We are again seeing a resurgence in studies in psychiatry. And part of it is because I think we're so desperate to find answers that we're like, oh, we're really mushrooms again. We're doing this again. So I have a lot of patients that are into microdosing, right? So they'll start off the day with a microdose of mushrooms to treat their anxiety disorder. And kind of be using on a frequent basis. With kids, we don't see as much microdosing as we do see use just for the high effect. Long-term effects of mushroom use, again, understudied, right? So I don't think that there's anybody out in their right mind gathering a bunch of kids together, giving them high doses of mushrooms, and then just watching what happens to their brains and hoping for the best. But the psychoactive substances certainly leave a percentage of the population more vulnerable to the emergence of serious mental health issues. And they won't know until they know that their brain, in the way it's like basically allergic, right? So I have some patients that are allergic to cannabis. Their friends can smoke it all day, just like their friends might be able to eat peanut butter and jelly sandwiches. But if they're allergic to peanuts, it can kill them, right? And then their brain is allergic to cannabis. And I find that for some patients with psychedelic mushrooms as well. But yes, very much on the rise.
And can you speak a little bit more about psychosis in cannabis?
Mm-hmm. Yeah, so psychosis in cannabis really, it presents as extreme agitation, hallucinations, paranoia, extreme paranoia, and often leads kids to the emergency room because you'll know it when you see it. It is not a comfortable experience for anybody, and we think that our kids are having a mental health crisis, which they are, but we're not necessarily thinking about it through the lens of cannabis-induced psychosis. And again, the scary thing about what we're learning about cannabis-induced psychosis is the high prevalence of transition from that experience, even after they become abstinent from cannabis, into serious mental illness like bipolar 1 or schizophrenic type disorder. The treatment remains much the same, right, with antipsychotics. One thing that we are exploring is the potency of THC versus the amount of CBD in a product. There is some evidence to show that higher amounts of CBD, like more balanced THC to CBD products, there may be a decreased prevalence of that person having a psychotic episode with that product. And we're even looking at CBD as a potential treatment for psychosis in serious mental illnesses like schizophrenia. However, it's really too early to say. So it's not as if I can recommend like, hey, tell your kids to smoke pot, but just use a lot of CBD at the same time. I would not say that yet.
Okay, thank you. Do you have suggestions for parents who have teenagers who are unwilling to engage in treatment? Like maybe there's treatment fatigue. They're saying, they refuse to go to Gateway Center for treatment.
Yeah, and so it'll depend on the issue, right? It'll depend on what's blocking them from going to treatment, right? So when we start exploring the idea of being drug free, oftentimes it doesn't work to just go up to our teens and say like, this stops now, right? We oftentimes need to sit down and again, like why the continued use, knowing that it's hurting yourself, knowing that it's hurting the family, what's driving it? Well, it's the only way that I feel good. It's the only way that I feel good when I go out. I feel so nervous around people, and when I do this, it makes me feel great, or whatever the reason is. First understanding that, and then maybe exploring alternative ways to meet that need. And then the next thing is remembering that these are adolescents and they own nothing. Like, this is where I can get a little bit, like harder in terms of how I treat, because these are serious life-threatening illnesses. And I want to take them seriously. I've lost at least 4 friends in high school and college to overdose, and like I said earlier, my brother more recently. So I do take these things seriously. And one of the things that we have going for us, again, with this population, is a very small window of some control, right? Every kid's different. You have to respond differently. There's no one right way to do this. I would recommend, if your kid is not willing to engage in treatment, I always recommend, whether or not your kid's willing to engage or whether they're engaged, that the parents also seek their own recovery. We can be in recovery from anything. It doesn't have to be substance use. We can be in recovery from anxiety or depression or bipolar disorder. We can also go to Al-Anon meetings and parent support groups, just at least to get our own support for a very scary situation. Because what these illnesses do is that they take our loved ones away from us. We're not, you're probably, for the parent who wrote that question, you're probably not talking to your kid when you're talking to them about treatment. You're talking to their substance use disorder. Like, that's who's running the show, right? And we need to remember that. And it can be hard to know, like, when you're talking to the illness and when you're talking to your child. And involving a treatment professional is always really helpful. Getting an outside opinion. Interventions can be extremely helpful as well for some. Setting boundaries, but making sure that if you set a boundary, that you're actually willing to hold that boundary. You don't want to be the parents at the restaurant with the screaming kids who say, you keep that up and we're leaving. And you keep saying that all the way through dessert and the check, right? So if you're going to have a consequence, make it known, give that warning shot, and then follow through, right? But in the meantime, involve professionals. It may just take a different tactic or a different way of reaching. It doesn't always have to be a treatment center either. There are wonderful youth supported and run groups like Smart Recovery, right? Sometimes there's a younger crowd I see with Refuge as well. And we also have good, AA and NA meetings too, where kids can start to at least explore the idea of maybe cutting back, right? Talk to them about a date, to set, right? Do you think that you could cut back and we can set a goal of you being off of, stop vaping or whatever it is, in 30, 60 days. With more serious substances, obviously, it's going to require a much more serious intervention, right? And immediate. So for like opioids or opiates, for example, you're going to want to get them with a treatment professional as soon as humanly possible. And understand that recovery is going to take a very long time. The effects that substances have, especially on our nucleus accumbens, are, it takes the better part of a year to for that part of the brain to heal, right? But there's ways that we can do this and ways that we can help this along, both with behavioral interventions and medication-assisted types of treatments.
Thank you so much. I've got a note here that the evaluation form isn't linked correctly. I apologize. I'll get that fixed, and the correct link will come to you via email tomorrow. Another thing, Missy, Brian, Kim, and River, if you guys have any comments that you would like to make, go ahead and get those prepared, and you'll be up in just a moment. We've got a couple more questions. Are kids who are taking prescription medications, are they more likely to be in danger of being exposed to pressed pills or taking them less seriously?
Yeah, no, they're not. And in fact, in most studies, they're shown to be slightly less at risk. Because again, if you think about some of the driving forces, right, a lot of times it's underlying mental health issues that might not be being addressed. And if they're being addressed properly with prescription medication and monitored and it's being taken appropriately, this may lead to some sense of relief to where they're not necessarily seeking out the pressed pill market. But more often than not, it's kids sharing their prescriptions. And I think this is another important thing for our community to understand and for us to understand as parents, is that these these problems do not happen in a vacuum, right? I've never met a 12-year-old that just decided to go out and cop one day, right? Like just like, I'm gonna figure out how to buy drugs all alone today, right? There's always involvement. And I think about these chronic illnesses like viruses. And when my kid was little, right, she had chickenpox. And I was immediately on the phone with all of the friends that she had contact with to say, hey, hey, this happened, it's serious. Here's what you need to look out for. I just wanted to let you know. And we don't necessarily do that, and we probably should when it comes to substance use disorders, right, that are contagions themselves. So if I find a joint in my kid's sock drawer and I have a choice to keep that secret, or I have a choice to maybe reach out to the parents of kids known to hang out with my kid and hopefully come at it through an adult lens. We don't have to be friends to do this, but hopefully we can come to an agreement of, how are we going to check up on our kids? How are we going to keep them safe? And again, maybe how can we as a community chip in and respond in a healthy way to give our kids a good time without the substances that they're now using?
Awesome. Jonathan, do you have any tips or tricks or training relevant to Narcan? The recorded training is River and myself and our approach, but
yeah, I mean, it's pretty basic. So I've done Narcan and overdose prevention training for police forces, for healthcare professionals, for schools. And, so like in terms of tips or tricks, no, just get it out there. Like any way we can get it out into the community. So I always tell people that even if I don't know you, if you recognize my face on the street and you come up to me and say, hey, can I get a prescription for Narcan? I will give that to you right on the spot, along with some brief training to make sure you know how to use it. It's important that we have as much of that product out in the community as possible. It's important to know, again, how to use it, but one training technique versus another, I can't speak that one's better than the other. I will say that if you have a young adult who's in early recovery and opiate use or opioid use is they're at risk for that, especially in early recovery. So this would often happen with clients who I was treating in a residential program, and they might be going home on a home pass. I would tell the parents it's the same rules as if your kid was an infant and sick. You're not going to get a good night's sleep, and you're going to be checking on them frequently, because overdose isn't something, while the overdose itself, meaning the effects of the overdose, can happen instantaneously, the death from the overdose is a pretty long process. In fact, having knowledge about Narcan or Narcan in the home would have definitely saved the life of one of my friends who died of an overdose the night after the funeral for his brother, another friend of mine who died of an overdose. And again, these aren't intentional, right? These are just people looking not to be in pain.
Thank you. The next question I have, I've translated. So if we're talking teenager to teenager, how can friends who use drugs help each other?
Yeah, so again, this starts with the parents, right? We need to be better, I think, at communicating with one another. We need to put aside our own anxieties and fears and be adults, right? So we can start by making pacts, right, that have been shown to work. So if my kid is known to hang out with your kids, when they were younger, I would call the parents and make sure that there's, do you have firearms in the home? If you do you lock them up? We don't have guns in our home, so I teach my kids, like, hey, if you ever saw this in somebody else's house, here's what you do. As they get older into adolescence, talking with other parents of kids and how are we going to respond if and when any of us find this floating around, because it's going to affect all of our kids, right? And we want to keep them alive, right? That's the goal. So I would recommend starting off by talking with the parents if possible, and then working with the parents in the community to find activities for these teens to engage in safely. And that doesn't mean that you're the party house, right? We want to make sure that that doesn't happen. And that should be one of the agreements, is that we are agreeing as parents not to be the cool parent that lets everybody come over and drink safely in their house. That is not good, right? But what activities can we get them involved in? What else can we do? How else can we reach them? And it may not be the parents to do this, right? We may need to involve other community members. I try and be as cool as I possibly can, but I know that I'm not cool with my 13-year-old. There's no amount, right? But there are other people in the community that can reach him, music instructors, people like this. And it's important to have positive young adult or adult influences in their life. So yeah, get them together, find out what they like to do, see if we can't find a way to promote that more than them feeling bored and using substances.
So if we have a teen who's listening to you,
what do you suggest that they do if they're concerned about friends and their drug use?
Yeah, reach out, right? So, I mean, we can always, certainly tell our friends. I know that when I first started to understand what substance use disorders were, it certainly wasn't when I was in high school. I mean, we were exposed to very hard drugs, like cocaine at a very young age in a very small school. And it was just normal. Like we were all just doing all of these drugs and drinking all the time. Started in 8th grade, 7th grade summer, right? Is when we started. And I never thought about problems until I learned more and I was in college. And at that time, I recognized my friend had a problem. Unfortunately, it didn't matter how much, I talked to them. I didn't realize at the time I was talking more to their addiction and less to my friend. So reaching out to adults that you can trust in the community, hopefully your friend and, hopefully here Tahoe Forest Hospital has a healthcare provider in somewhere here that they can trust and talk to in confidence, right? And with confidentiality to start to explore some of these things. And take them to a meeting, right? There's for some recovery support meetings, there are what are called open meetings where you can go as a guest, just as an observer, right? So you're not there because of your own addiction issues, but you're going as an observer. Like, hey, you want to go do this sometime? Like, I want to go check this out. I'd like you to come with me. I want to go, right? And just really finding those alternatives, those replacements, and tell them how much you care about them, right? Find ways to break through. The same thing that parents would do, like, why do you use so much? Like, why is your experience so different maybe than my experience? What's going on? And maybe they'll open up and tell you that, I'm suffering from all this anxiety, this pain, this trauma, right? This other stuff that's going on that no one can see. And then hopefully pointing in the right direction. Involve the adults. Hopefully you've got good school. I know we've got good school counselors in this town. I've met them. They're fantastic. So just reach out.
Thank you. So the next question, Kim, you're going to be on deck. Is there someone going into the classrooms and doing presentations for the kids? Could you speak to what takes place in the Truckee Tahoe Unified School District?
Yes, we do have education in the middle and the high school. We start to touch on it in elementary and second step, kind of character development and making good choices. And then we get into education more at the middle school level. And then at high school, we do it through health classes, and we have an athlete committed program where it's a peer-to-peer model and students are messaging younger students. River actually has been involved with that program, so she can speak to that a little more in detail than I can.
Yeah, the athlete committed high school students are going into elementary and middle school, 5th, 6th, 7th, and they are actually, they designed this great presentation about the vaping and the harms. They actually bring examples, they have skits, they talk about, ways to say no. They kind of role play with the kids. It's really fun and interactive. Obviously with COVID, they did it in the beginning of last year, but they're working on converting it to a virtual presentation and trying to figure out whether they're going to go ahead and try to do that or do a, just wait until the kids go back to school. So, but it's fantastic.
Can you guys hear me?
Yes, go for it, Greg.
Oh yeah, so we also here at Gateway do mindfulness-based substance abuse treatment in some of the schools around here, the continuation high schools, the community school and Sierra High, but also we've had cohorts even in middle schools, North Tahoe Middle and Alder Creek Middle and North Tahoe High. And it's an evidence-based program that I think is very informative about drugs. It's not punitive, and also gives them some mindfulness tools that they can use to, deal with some of these pressures and situations that would cause them to seek using behavior.
And Greg, do you guys have sober coaches or interventionists?
Not as such. We do work like that through our one-on-one, nature-based mentoring program, Whole Hearts, Minds, and Bodies, but we don't have that as a title per se. But I tend to work with a lot of the kids struggling with addiction, the more high school aged kids, like my mentees tend to be a lot in that demographic. Yeah.
All right, thank you.
Thank you so much. And there's some great notes in here from Greg. all NA meetings in Truckee are open meetings. Missy said in connection with mushrooms being popular right now, LSD is also popular. Yeah, I would ask our partners, are there any closing remarks from the school district, from the Forward Coalition, or from the hospital system?
This is Greg from Gateway. We're not a partner like that, but I just wanted to say, Jonathan, thank you very much. I thought what you said was very well balanced and very nuanced and in depth. You know, this is tricky terrain to navigate. There's no, that I have found, there's no sledgehammer answer. There's no cookie cutter answer. It's a nuanced approach, and every person is an individual. They're all different when they come in with different needs. So I thought you really covered that well. And I just wanted to say thank you very much for your time.
Thank you very much. And I'll try and leave us on a positive note, right? So here's the cool thing, right? Is that these disorders respond to treatment 100% of the time if we follow our treatment 100% of the time. And that's the cool thing. Like these do not need to be death sentences, right? Treatment will work 100% of the time if we can figure out a way for someone to work their treatment 100% of the time. It's awesome. You know, we need to remember that these are diseases of choice, meaning we don't choose to have these problems. My brother didn't choose to have whatever genetic package he had that I didn't. You know, I was allowed to pick things up and just put them down. And again, some of my friends and family members just could not do that. But choice making is the defining factor in these things, as they are with many chronic illnesses. So how do we help kids make better choices, right? And there's lots of ways to do that. And we touched on a few tonight. It starts with this conversation. It starts with the adults in our community thinking about what else can we do here. And again, I think that there's a ton that we can do in this community to keep our kids safe. There's a lot of cool stuff going on. So yeah.
Awesome. Thank you, Jonathan. Thank you, everyone. You stayed almost 30 minutes over schedule. I appreciate your time and your interest in this. This isn't the end of it all. This is just one conversation that we can continue to have as time goes on. So take care. Thank you so much. Look for my email.